Hey guys, Dr. Ben here, Functional Medicine Center, is going to talk to you today about your brain, about people's brains that have Alzheimer's, people's brains that are neurodegenerating. And this is something that is going rampant out there. The stories that we hear of people's brains neurodegenerating, getting Alzheimer's, and just those really, really sad stories that are taking place with people's families, their loved ones, having to lock them in the basement, all of these things. What are we to do? You know, there's drugs that are coming out. Do they actually work? What are some of the concerns with that? But what you can do now, instead of taking the $56,000 a year, I'm not sure if anyone's seen this. Give me a thumbs up if any of you guys have seen that report. $56,000 a year for this drug called Aduhelm, and that drug is going to, in theory, the hope is to get rid of some of the plaque. And there's some thumbs up there. Some of you guys have seen that. Yeah, Eric, my mom's got dementia. It's rough seeing that happen. And so this Aduhelm is definitely going to be a big part of the conversation when people are talking about Alzheimer's. So this drug, it's made by Biogen. It's an injection, and it costs $56,000 per year. So much so that if 1 million people that have Alzheimer's took this drug once a year, it would be $56 billion. And that's more, if any of you are on Medicare, Part B, the total amount of drugs that Part B paid for in 2019 was only $37 billion. So it would be through the roof on what we're seeing that Medicare would do. They'd have to raise their premiums, all these different things. So here's the interesting part with this drug is it's not a slam dunk. You know, for $56,000, and I'm going to give you some things that you could do with $56,000 to change everybody's brain in this country. For $56,000, you would expect like, oh my gosh, it reversed Alzheimer's, and people are like getting up and dancing and remembering, you know, who their kids are and all these different things, but we're not seeing that. And you know, there's a lot of reports that people aren't even sure with the research and the data whether it even helps slow cognitive decline, and which is a huge part of what people are wanting out of the Alzheimer's. They actually stopped the trial. They started in 2015. They stopped it in a couple years later because they were getting some sketchy results and some inflammation in the brain, some different things. The FDA went back. They called ad hoc. They went back, looked backwards, and said, oh, you know what? I think it actually was okay, and we'll approve it for you guys. You know, which is a little bit sketchy in and of itself. One interesting thing that we've actually seen with this medication is that 40% of the patients that were in 2 late-stage trials, meaning that they went through you know, the whole process, 40% of the patients on the MRI had brain swelling and hemorrhaging. So this isn't just a little bit of inflammation or whatever. I mean, it's a significant brain swelling and mind, they call it tiny hemorrhaging, but lots of little hemorrhages in the brain. And so, you know, it definitely is sketchy, a little bit, not quite, one, going to be very effective, but also problematic. There's a gene, and I've got this gene, so 25% of the population have what's called the APOE4 gene, and it's called the Alzheimer's gene. Basically, it doesn't allow the brain to heal as quickly. And so if you get a head injury, I've had multiple concussions, not only is somebody 4 times as likely to get Alzheimer's if they have APOE4, they're 10 times as likely to get Alzheimer's if they have a concussion and have APO4. So all the things that I do for my brain is really because of this APO gene that we're looking at. What they found was that 25% of the population have this gene, and the people that have the gene and took that drug ended up having worse side effects. And yet, as they're going to start putting this drug out to the masses, they're not having everybody do the genetic test and see if they're going to have this problem. So that's kind of the history on this drug. You know, it's pretty sketchy, a little bit scary that they're approving it, and you know, a huge financial burden on the masses. $56 billion a year is what they're expecting it to be. So here we go. What can you actually do about Alzheimer's though? Because hey, Cher, good to see you. what can you actually do about Alzheimer's, what can you do about your brain function, and to just really be able to be as vibrant as possible. And so for me, if a patient comes in and I'm like, okay, and not everybody's got $56,000 to spend, but think about this, we could outfit somebody's entire room, and I just want you to get perspective on this. Hey, Michelle, up there in Estes, think about this. If I outfitted somebody's entire room in their house as like a brain studio, I would have them get an oxygen therapy, a live O2. So it's liveO2.com. Look it up. They're about $4,000. It does oxygen saturation deprivation. Hey, Sharon. And what's the name of the drug you just spoke about? It is called Aduhelm, Aduhelm. Just do some research. Boston Globe had a crazy article on it. CNN had a crazy article on it. I mean, just massive information. So here's what you need to do your brain room and brain therapy. If you or a loved one has Alzheimer's, and $5,000-$10,000 is not a big deal when you're thinking about a loved one, you get a live O2 machine. It's oxygen. You saturate, you deprivate, and you get oxygen into the brain. It's kind of like a hyperbaric chamber. Those are about $4,000, but a huge benefit, huge boon to the brain. You get a portable sauna. Hey, Ida, good to see you. Trying to recoup research money. Yeah. Hey, Nicole, great. Pop down below where you guys are watching from. Love to see everybody out there. I would do a portable sauna, so the kind that the head sticks out, and so that you get blood flow into that brain as well. Those are $400 or $500. You could do that. Who's this? Michelle, mild, yeah, FTD to find out what is beneficial to help her, working on testing. Yeah, absolutely. So you want to get oxygen to the brain. You want to do sauna, not necessarily for the head. Hey, Danny, you are in Israel. Great to see you. And then another thing that you would want to do is either in office or home neurofeedback. So you can get a neurofeedback machine that is going to help train those brainwave patterns and keep it going in there. So we would do that. As far as supplements go, you would want to pine bark is huge for blood flow to the brain. So pine bark extract is really, really good. Glutathione is another one that's really good for the brain. Hey, Don, down there in Louisiana, you want to get a daily exercise rhythm going. You want to get up and get that blood flow going every single morning. You want to do some HIIT, high intensity interval training, where you're going to be doing 5 to 10 minutes of burpees or wall balls, or there's a lot of different things out there that you can look at. So you want to be working on that blood flow every single day. You want to be going out for walks, hikes, bike rides, all of those. But you also want that high intensity where that blood flow is getting up into that 180 minus your age range, and you want to get that blood flow going. You want to make sure that you're getting good quality sleep so that brain can actually regenerate and repair. So it's not just about take this supplement or do these different things. You've got to stop damaging, but you've got to start repairing that process as well. So you've got to get that good quality sleep state. You need to have your blood sugar as stabilized as possible. That's why we use glucose monitoring with patients. And we know that they call Alzheimer's type 3 diabetes. So if your blood sugar is whacked, and this is one of the main reasons I keep my blood sugar as steady as I possibly can, because if that blood sugar goes up too high, it's going to create this inflammation. You're going to have going on here, and we're going to have this early stage Alzheimer's in a lot of people, and it's going to be driven by this neurological degeneration. So you've got to keep that blood flow going well. You can do that supplementation. You can do that with exercise and movement. Body work's going to be great. Massage, a lot of different types of body work to keep the toxins flowing and out of the body. You want to make sure that you're having daily bowel movements. If you're not going every day, we always say ABP, always be pooping. You got to be going every single day. So there's a lot of things, for $56,000 a year, somebody could come in every single day. They could move in with us, for goodness sake. And yet that's what they're going to be doing, this injection once a day or once a year, and that's going to be their treatment, and that's $56,000. So it's pretty Shara ABP. We've got to take a step back and go, okay, what are we really doing? What are we doing for people to get their brains working as well as possible? And for those of you that want more information and how to do a home brain gym, shoot me a message. Not everybody's got that financial ability, but if you do, there are things that you can do right now, and for $5,000 or $10,000, I could point you in the direction that you could make some massive changes in you or a loved one's life, and way more than even some of these drugs out there. So just always be researching, always be looking at is this legit? Is that really going to be the next be all and end all? Because it's usually not. If something is too good to be true, like some of these things, it probably is. It takes work, it takes energy. You've got to move your feet, and that's ultimately what we have our patients do, what I do myself, because I don't want my kids locking me in the basement and keeping me from wandering down the street. So, all right, guys, love having you on. If you've got any questions about the brain, pop it down below. But we can see some massive changes very quickly, and really get cranking on reversing neurodegeneration. It is possible. So take care, everybody. Have a great night. Bye bye.